I'm a registered nurse. I work on the ICU step-down unit called a progressive care unit. I take care of semi-critical patients ranging with diagnoses from post-heart attack, stroke, GI bleed, cardiac arrhythmia, anything that's going to require heart monitoring. I was always interested in the medical profession, especially growing up. I have my grandfathers both are doctors. I have a lot of aunts who are nurses. When I graduated, I took a little bit of time off and I traveled, and I was exposed to a lot of care for the elderly and for the sick in Calcutta, India, when I did some mission work. And so I came home and I got my nursing aid license and I took care of my grandmother. And it was about that time that I decided that nursing was kind of a natural profession for me. I would say Christendom's education has done an amazing job in interviews with nursing supervisors, because they look at my resume and they see a previous degree from a liberal arts college with a history major, and they say, well, what brought you there and what brought you to nursing? And so we start talking about Christendom, and I tell them, you know, there's a core curriculum, I study philosophy and theology, and so now the supervisor is looking at a nurse who studied Aristotle and who is also can take care of patients. So you look more well-rounded, I think, in interviews than to your bosses. In the medical field, there's such a gray area, and it's a gift to know that there's the Catholic authority to look to with regards to end-of-life, bioethical decisions, classes like Doctrine 101 with extraordinary versus ordinary means. That has helped a lot, and I think of Dr. Marshner's junior year core curriculum with the moral theology and apologetics. To be a nurse who values life from the beginning to the natural end, I would say you definitely need a good Catholic or Christian education, just so you know that you can't make somebody comfortable and kill them in the process. There's different levels of care, and especially in our culture, you do need a little bit of guidance. And I think that Christendom's education has helped a lot with that. I miss the culture. I miss the friends, the community, the masses, everything basically. It's a difficult choice because you're faced with a career, and then you're faced with Christendom's education and what Christendom can offer you. You'll be able to understand your faith, so that if you do go on to another degree, you do go to a medical degree, you'll understand why a decision is correct or why a decision is right and moral and just, as opposed to, well, the Catholic Church says this, so I must do it. You'll understand the beginning of that foundation. You'll understand why the Catholic Church says that this decision is right, this decision is moral. Your faith will be much stronger. It might slow you down a few years. It might, you might have to do extra classes in order to go to the career that you want, but it's something that will benefit you your entire life.